Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today, we're going to be talking about back to school for your kids. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn with Dr. Chuck, and welcome to Your Filthy Mouth. We are so excited because it's almost a favorite time of year. It's back to school. It's my favorite commercial is the Staples, where the mom's got all this back to school items. You know, it's the best time of the year. But the interesting thing is, Dr. Chuck, that we're seeing a lot of checklists with markers and folders, and I'm guessing there's probably a pretty good checklist that you could give us for getting our kids back to school dental-wise.
Well, back to school, you want your kids to be dentally healthy, and there's a couple reasons for that. Research actually proves that if a child misses school because of a toothache, their grades suffer. If they miss school because of a scheduled appointment, there's no suffering of the grades. So, it's hard to study when you're hurting. So, it's a good thing to keep the mouth good and healthy at the beginning of the year, throughout the whole year, even into next summer,
And, I mean, look, back to school pictures, they're just going to happen. You need to get nice and clean up. We get new shoes, new clothes, new haircuts.
Yeah.
Why do we not instantly think about back to school dental care?
It's a good idea. So when you're school shopping, think about getting a toothbrush. Now, I really recommend electric toothbrushes for kids, and they're not that expensive. I mean, you just do a better job. The whole idea is I could care less about technique. I really don't. I care about the results. And what we're trying to do is get the bacteria off the teeth without damaging the tooth or the gums. So if you use an electric toothbrush, it's just easier, and sometimes it's more fun for the kids. So
It is fun.
yeah, it is.
Yeah.
And some of them have little timers in the handle. Some of them actually have music to go with them. So, you can shop around. And again, you don't have to spend a fortune. But an electric toothbrush is a really good thing to start with.
When you say music, like Rihanna, or you're talking about like the countdown song for how long?
Countdown
I
song,
got you.
yeah,
Okay,
yeah,
all right.
yeah.
Okay, other items on the checklist, back to school list for dental care.
I'm a huge fan of disclosing solution or disclosing tablets. There's some mouth rinses now that have disclosing solution in them. So what that does is that stains the bacteria. That stains the plaque that's on your teeth. So plaque is the same color as your teeth. How do you know you got it off after you brushed your teeth?
Right.
You just look at it looks good.
Right.
Well, let's stain it. And when you stain it, it's like, oh my gosh, did I miss that? So, disclosing solution, and this is where I'm getting in my soapbox here a little bit, but this is where
You get there. That's good. That's all right.
if we can have mom and dad be the examples for the kids, because if mom and dad are not taking care of their teeth, I guarantee you the kids are not going to take care of theirs.
So true.
If you can pick a Saturday night. Everybody goes in the bathroom, brushes their teeth as good as they possibly can, flosses, irrigates, whatever technique you're going to use in there. Choose up one of these little tablets or use one of these rinses, and then let's look in each other's mouth. Let's see who does a really good job and who does an other than good job. And so for the ones who do a really good job, have some type of a prize. I mean, it can be movie tickets or something like that. It doesn't have to be
That's
candy,
fun.
Something good.
I bet mom and dad will be surprised. They'll think, oh, we're going to win. We do a good job. We're going to do better than the kids, but they might be surprised, right?
Well, sometimes mom and dads aren't doing as good as they think they're doing. And that's why disclosing tablets are not just good for the kids, but they really are good for every age. I don't care if you're 90 or if you're 9. I mean, it's the same bacteria. So we got to take care of it.
Disclosing tablets, you go to yourfilthymouth.com and you can find easy to buy because they're not so easy to find.
I wish that more pharmacies would carry them. You can get them on Amazon. I mean, they're inexpensive, but they're just like taking a test. If you take a test and it's never graded, how do you know how well you did? So with this, you can kind of grade yourself.
That's
or
a great
grade each other.
Back to school tie-in. That was wonderful how you taught that in.
There you go. Yeah.
I'm thinking about back to school kids with braces. What are some things we should keep in mind for that?
Well, cleaning, if you've got braces on, it becomes more challenging. You've got all this hardware in there. So I'm a huge fan of water irrigation, directed water irrigation. That can be with a water pick, a shower breeze, an oral breeze. These are all available. You can get them all on Amazon. And so we're not pushing any particular product.
Right,
What
right.
we're pushing is a healthy mouth. And to get that healthy mouth, you have to get the bacteria off of the teeth. And when you got brackets from braces, that becomes more challenging.
Sure.
If you don't get the bacteria off, then you end up with white blotches all over your teeth when you take the braces off. And those ugly white blotches are not the best. You say, well, we can put crowns on the teeth. Yeah, but that's all
What?
preventable.
Right, exactly.
Don't have to go there.
And it takes years. I mean, honestly, I had that situation. I got braces in 3rd grade, and it takes many years for the teeth color to even out.
Yeah, it really does. And again, prevention isn't sexy, but it saves time, money, and pain, you know. And sometimes paying that extra money for if you have to put porcelain crowns on some of these teeth that all this could have been prevented, you know, that's no fun. That's pain in the wallet. Yeah.
It's true.
Yeah.
Toothpaste. Is there a choice? I mean, does it matter if the kids want to lean towards children, you know, orange or strawberry flavored toothpaste? Does it matter?
Not really. The whole idea is no matter what you're using, you need to grade yourself at the end with a disclosing solution or tablets or mouth rinse on that. So some of the toothpaste that I'm not really thrilled on are some of the whitening and the tartar control toothpaste, because for many people that can cause sensitivity on their teeth.
Okay.
So even on kids. So just the regular is fine. Again, it's not necessarily the brand. It's getting in there and doing a good job, taking that time. And that's one of the things right there. It takes 5 to 7 minutes for an adult to properly clean their teeth.
Wow.
You can't do it in 3 minutes. It's like saying, I have an hour, I think I'll go paint the whole house. Well, you can slap some paint on the wall, but you're not going to do a good job.
Sure.
And the whole idea is do a really good job on cleaning your mouth 1 time a day is so much better than doing it 2 times, 3 times, 4 times a day wrong, because you keep missing the same places. So really take that time 1 time, whether it's morning or night, you know. If you want to do it both, man, that's just
great,
super. That's
yeah.
super. But pick 1 time and take your time and do a really good job.
You know what I appreciate about you is that you don't, you know, say, look, you got to do it 3 times a day. You're realistic about what you're asking people to do.
Well, if you take all those, 30-second times that you're doing it every day and just lump it all up in 1 time and do it, it's not costing you any more time,
Sure.
but you're doing so much better, so much healthier for the mouth.
So back to school with kids. I know we've done a show before on inspiring kids to brush their teeth. Maybe we can just, since we're doing a back to school, talk about the different ages of how we get them to want to brush their teeth. Because as parents, you can only beat on them so long emotionally to brush their teeth,
Yeah.
So what are some of the tips,
One of the things that I found seems to work really good, especially with the younger children, is that you talk about sugar bugs. And the sugar bugs, that's not black, okay? Sugar bugs on your teeth. And the reason you want to get the sugar bugs off your teeth is that what the sugar bugs do, they go poop all over your teeth.
Can't have that.
That poop, little kids understand poop.
Right.
I could talk about lactic acid byproducts and demineralization of the enamel, but they're not going to get it.
Right.
But they get sugar bugs and sugar bug poop, and they don't want poop in their mouth.
Right.
And you tell them, if you wake up in the morning, your mouth really tastes funny, that's sugar bug poop. You didn't do a good job. So take your time and really clean the teeth so you don't have sugar bug poop in your mouth. So.
And then we move into the teenage years.
That's another thing.
And they're not inspired by sugar bug
poop. Nah, yeah, they could care less there.
Right.
Now they're looking at smiles, and the guys are looking at the girls look at the guys. So what you do is you tell them, look, before you start kissing somebody, you may want to look in their mouth, because if they got a bunch of cavities and you don't have cavities, and you start swapping spit, and even if you're only kissing on the lips, you're swapping spit, you're going to get the bacteria that cause their cavities.
Wow.
Is it catchy? Yeah, if you don't have the bacteria, you're not going to get the cavities.
Right.
So if you get someone who's got a lot of strep mutans in their mouth and you start swapping spit with them, well, you may get a lot more than what you bargained for.
That is so interesting to me.
Yeah.
Just never think about that. So, yeah.
Yeah.
Okay. Yeah, I'm still processing. Anyway, all right. Well, listen,
And the older you get, though,
Yeah.
and I'm just talking about the adults now, because it's back to school, but we want the adults to get it too,
Right.
is that one of the reasons you want to keep that mouth really good and clean is because of the bacteria in your mouth, how it gets into your bloodstream. So we're getting into health,
Okay.
the health aspects of it, because they've shown that 50% of heart attacks are triggered by oral infections. 90% of oral infections have no pain. You don't even know what's going on. So you want to take your time, clean that mouth so that you don't have the problems with cardiovascular disease, with diabetes. Now they're showing oral bacteria in the brains of Alzheimer's patients. So, I mean, there's all these different things. So different age groups are triggered by, are inspired, are motivated by different things. So, but the kids, sugar bug poop.
I'm guessing that when you catch kids at a young age and they start developing them, by the time they are senior citizens, they've already got those patterns established.
That's the whole idea. If we can get the younger kids especially doing a good job, taking that time to really clean. This is part of a habit. Kids look at mom and dad. They see what they do. If mom and dad are doing it, there's a much higher chance that the kids are going to do it.
Right.
What's the old thing? Do as I say, not as I do. Well, no, that's not okay.
Right.
So we have to be the examples.
That's true in everything. I mean, credit cards,
Absolutely. Sure.
how you handle your money, all kinds of
Finances,
stuff.
health, diet. You go the whole thing.
Yeah.
One of the things, a lot of people are concerned about genetics. Well, this is genetically what it is. What they're shown is that so much of it is lifestyle. That's what the kids really inherit from it. This is the way we eat. This is the way we exercise or don't exercise. This is the way we take care of ourselves or don't take care of ourselves. So it's lifestyle.
Interesting.
So back to school, let's get a good lifestyle.
All right, we're going to come back with a question of the week. We got Andy asking a question next.
Here's Dr. Chuck's question of the week.
Hi, Dr. Chuck. This is Andy. I chipped my tooth, but I don't have any pain. It's in the back. So is this a big deal?
Fantastic question. What is the big deal if it's a chip in the back? Does it matter?
Yeah, I mean, if there's dirt under your bed, does that matter?
Well, it does. It does.
Yeah.
Yeah, but teeth can be so expensive. I mean, you have to put so much more thought into.
Well, let's look at the anatomy of a tooth. A tooth has different layers. The outside layer is called enamel. The next layer is called dentin. Now, the dentin is 700% softer than the enamel on the outside of the tooth. So if you've chipped that tooth and you chip through the enamel down to the dentin, the chances of getting decay on that dentin have just skyrocketed.
Oh,
So once you get this decay going on inside, a tooth can look like an eggshell sometimes. With all that dentin is just eaten out, and then it gets to the pulp of the tooth, and you have a lot of other issues that are completely preventable. So when you have that chip on that back tooth, yeah, get it filled, get it taken care of.
Okay.
If it's a tiny chip, sometimes you can just smooth it off if you haven't gone through the enamel.
Oh, that's a great idea.
But if it's gone
Yeah.
through the enamel, you've got to take care of it. Nip it in the bud, take care of it.
And is it just a matter of time probably till it starts hurting? If it's a big
It may
chip?
or may not hurt. And
Okay.
again, that's the big. People think dental issues are always going to hurt. No, a lot of them don't hurt. But all infections, whether they're tooth infections or any infections, they produce pus, and that gets into the bloodstream. I don't care what age you are. So yeah, take care of that little chip before it gets big.
Yes. Andy, good question.
Yeah.
And Andy, we're going to send you our very first, we got our Your Filthy Mouth mugs in. So we've been talking about it for a while, and they came out really nice. So if you send in a question at yourfilthymouth.com and we use your question, you are going to be the proud recipient of a Your Filthy Mouth mug. They look good.
They work too.
Yeah, they do. We've been testing quite a lot. We've given it a good try. Okay, so let's go ahead and wrap up as we talk about back to school. Things that should be on the checklist that should
Okay.
be going into the cart for kids to go back to school with, dental-wise.
Toothbrush, ideally an electric toothbrush. Now, I'm not hung up on brands. One that they're going to use. Best people. What's the best one? The one you're going to use. Okay. So toothbrush, disclosing solution, tablets, mouth rinse, whatever, so that you can grade that test that you just took. Make sure that you did good on that. And then the third thing is have mom and dad be the example. Have them be the ones to show the kids this is how you do it, and if the kids are going to watch what you do, and they're going to mirror what you do.
Yeah.
So you're the example.
So back to school, very important. Maybe make it a habit. Every August, you get your hair cut, you get your new clothes, and you go to the dentist, right?
Yeah.
All right, very good. Well, thank you.
Fantastic.
Good show. Thank you.
Our pleasure. Good luck in school too.
Yeah.
Yeah.
Get
Study
A's.
hard. The harder you study, the luckier you get.
Yeah. Sure. There's some wisdom. We're going to end on that. I can't top that.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.